This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. In order to choose the most appropriate treatment for a posterior cruciate ligament, or PCL injury, it is important to understand its severity and complexity. A complete PCL tear with a posterior translation of 12 millimeters or more is classified as a Grade 3 PCL injury. Such injuries are often accompanied by other ligamentous injuries, particularly those involving the posterolateral corner, or PLC, of the knee. This study aimed to investigate the prevalence of isolated Grade 3 PCL injuries, that is, cases without any additional ligament damage, and to compare the clinical outcomes of isolated PCL reconstruction versus combined PCL and PLC reconstruction. A total of 448 patients with PCL injuries treated between 2008 and 2020 were respectively reviewed. Among them, 254 patients had isolated PCL injuries, of which 60 had isolated Grade 3 PCL injuries. After excluding cases lacking complete medical information or follow-up data, 30 patients were included in the final analysis. Of these, 17 underwent isolated PCL reconstruction, while 13 underwent combined PCL and PLC reconstruction. For both groups, stress radiograph or telos data, along with International Knee Documentation Committee or IKDC subjective scores, Ligament knee scores, and Tegner Activity Scale scores were evaluated before and after surgery. Post-surgery improvement in posterior translation was comparable for both methods. Improvements in mean IKDC, Ligament, and Tegner scores were observed for both groups. Patient-reported outcomes did not differ between the two groups. Overall, this study showed that an isolated high-grade PCL injury was observed in 60 out of 254 cases and affirmed that isolated PCL reconstruction is an effective treatment option for patients with isolated Grade 3 PCL injury. Both isolated and combined reconstruction procedures produced comparable subjective and objective outcomes.